I'm Dr. Soumya Basanth, working as a cornea consultant at Zamandar's Microsurgical Eye Center for the past 7 years. My main area of interest is cornea and its diseases. Keratoplasty or corneal transplant. What do we mean by keratoplasties or corneal transplantation? Where the diseased cornea, the cornea is the black front part of the eye which is diseased or it has some issues, is replaced by a donor cornea. Basically, we have full thickness and partial thickness. If you go by the anatomic structure of the cornea, it has 5 layers. The topmost part is called the epithelium, where it rests on a basement membrane called the Bowman's layer. The bulk of the cornea is formed by the stroma. Then we have a Descemet's layer followed by the endothelium. Each layer can be grafted separately. There can be a full thickness graft or a partial thickness graft. Full thickness graft is called penetrating keratoplasty. The reasons why we do these keratoplasties, either full thickness or partial thicknesses, one is tectonic integrity. When there is some deficit, that's when we, to prevent and further damage and protect the integrity of the cornea, this is done. That is called a tectonic graft. Or a therapeutic, when the diseased cornea, because of any kind of infections, be it viral, fungal or bacterial, it is replaced with a donor graft to abolish the infections. Then for optical keratoplasty is when post therapeutic keratoplasty, or there is a scar which had happened in the yesterdays or in childhood, to give them best optical outcomes. That's when we do the optical keratoplasties. Both full thickness and partial thickness are done for the same reasons. Partial thickness is only one part of the cornea is grafted. That is, we divide that further into anterior. Anterior is the anterior most or the front part of the cornea is grafted, and the posterior keratoplasties. Anterior keratoplasties are further classified as anterior lamellar keratoplasty or ALK, deep anterior lamellar keratoplasty DALK and ALK. And posterior lamellar keratoplasties include DLEK, deep lamellar endothelial keratoplasty, DSEK, DSEK, Descemet stripping endothelial keratoplasty. Then the other variety in the DSEK is DSAEK. That means Descemet stripping automated endothelial keratoplasty, and then we have DMEK or Descemet membrane endothelial keratoplasty. These are very highly advanced technologies where we replaced only the diseased posterior layer, that is the posterior part of the cornea. These endothelial keratoplasties are highly advanced. We use state-of-the-art technology to perform this. All this is done when we have all inherited disorders, like there's a condition called Fuchs endothelial dystrophy, where only one layer or the posterior most layer, the endothelium of the cornea, is diseased. We replace only what is the diseased part, and so that the rest of the cornea is not touched or it's untouched. The second other option where we do these endothelial keratoplasties or posterior lamellar keratoplasties is pseudophakic bullous keratopathy, which is a condition which occurs cataract surgery where the endothelium is damaged because of surgical insult, where the endothelium is damaged and non-functional because of the surgical insult. That is only that diseased part is grafted. This is in brief what we do about these keratoplasties. In a nutshell, what are the different types of keratoplasties available: posterior, anterior and full thickness or a partial thickness, and different categories in each variety as I have discussed before. Thank you.